Okay, now that we've looked at the hip joint, we can move on to the muscles that act over the hip. As mentioned in the previous lecture, the hip joint is classified as a synovial ball and socket joint. This means it is a multi-axial joint allowing movement in all three cardinal planes. That's flexion, extension, abduction and adduction, and then medial and lateral rotation. And in order to achieve this, we have muscles. Muscles have to cross the hip joint to produce these movements. And functionally, we divide the muscles up into their groups. So we have the flexors, the extensors, the adductors, abductors, and then the medial and lateral rotators. However, since most muscles that cross the hip joints do so obliquely, they all produce more than a single action. So for example, a hip flexor may also abduct and may also medially rotate. If we start off looking at the movement of hip flexion is produced by two main muscles. These are situated in the posterior aspect of the abdomen, so they're difficult to palpate. They are the muscles psoas major and iliacus, and they're collectively known as iliopsoas. They're often grouped together because they share a common distal attachment. Iliopsoas passes distally to the lesser trochanter, and as it does so, it goes from the inner aspect of the abdomen, from the inner portion of the abdomen, it runs over the anterior pelvic brim here before darting backwards into the lesser trochanter. And in order to prevent friction between the deep surface of the iliopsoas tendon, there is a bursa that separates this structure from the pelvic brim and the anterior hip joint. This is known as the iliopsoas bursa and was visited briefly on the hip joint lecture. The action of these two muscles is to produce hip flexion. They are powerful flexors of the hip joint. But if we then fix the femur, these two muscles can act to produce an anterior pelvic tilt, so the distal attachment remains the stable portion and the proximal attachment is pulled towards the distal attachment. Or psoas can also produce flexion of the lumbar spine. The attachments of these muscles are as follows. Psoas major arises from the anterior surfaces of the transverse processes of T12 to L5, from the lateral aspect of the vertebral bodies and from the intervening discs. Iliacus, on the other hand, attaches onto the upper 2/3 of the iliac fossa, which is the internal surface of the ilium. As I said, the two muscles converge together and they form a thick, stout tendon that eventually inserts into the lesser tuberosity. Iliacus has a nerve supply from the femoral nerve, whereas psoas major takes its nerve supply directly from the anterior primary ramus of L1, 2 and L3. Although iliopsoas is the primary hip flexor, there are secondary hip flexors. They are rectus femoris, which is part of the quadriceps group, so its primary action is one of knee extension. There is the muscle sartorius, which is a long strap-like muscle that arises from the anterior superior iliac spine and passes obliquely across the anterior thigh. And then there is a small muscle on the lateral side of the hip called tensor fascia lata, and this is often grouped in with the abductors because that's its primary action. On the adductor side, there is a small muscle called pectineus, which assists with hip flexion. Anatomically, these muscles belong to other groups, but they are secondary hip flexors. Rectus femoris is a typical bipennate muscle. It arises proximally up here from the anterior inferior iliac spine and a small groove from on the anterior aspect of the pelvis just above the acetabulum. It runs down as a bipennate muscle, so it has quite a feathered appearance, running in the quadriceps compartment before blending into the quadriceps tendon. And the quadriceps tendon then goes off and eventually attaches onto the tibial tuberosity down here. Sartorius, on the other hand, is this long strap-like muscle. It's called the Taylor's muscle. It arises from the anterior superior iliac spine. It passes obliquely through the anterior compartment of the thigh before passing posteriorly behind the medial femoral condyle, then behind the medial tibial condyle before attaching eventually into the upper medial aspect of the shaft of the tibia. This section here, this area here, is known as the pes anserine insertion. And the pes anserine insertion is separated from the tibia again by the pes anserine bursa. Both of these muscles take a nerve supply from the femoral nerve L2, 3 and 4. Tensor fascia lata can be seen here. It arises from the external surface, from the lateral aspect of the anterior superior iliac spine and from the outer lip of the iliac crest as far as the tubercle. It passes obliquely, downwards and laterally before blending into the fascia lata and a thickening in the fascia lata. The iliotibial tract, as can be seen here, which runs down and eventually inserts into Gerdy's tubercle. Some of its fibers blend into the patella, some of its fibers blend into the upper fibula. This has a nerve supply from the superior gluteal nerve, a common nerve supply with the other abductors, gluteus medius and gluteus minimus. Pectineus, on the other hand, arises from the superior pubic ramus here. It passes obliquely, laterally and backwards before inserting into the pectineal line on the posterior aspect of the upper femur. Its function is to flex and adduct the hip, and it's possible that it may assist with medial rotation. Again, its nerve supply is partly from the femoral nerve L2-3 and partly from the obturator nerve. Pectineus is typically grouped in with the adductor group.